Group of drug is thiazides. Thiazide actually it binds with the sodium chlorine channel in the DCT. Let's see here. This is sodium chlorine channel in the DCT. Thiazide drug is very important and very functionally used. How? Because when thiazide drugs bind here, the sodium and chlorine concentration in the inside the cell will decrease. And see here, this is sodium potassium ATPase, and sodium potassium ATPase is continuously working. When sodium potassium ATPase continuously working and this channel will block, then inside the cell sodium deficiency occur. When sodium deficiency occur, then what's happened? This is the sodium potassium exchanger channel. So this is the sodium calcium exchanger channel. So when sodium decrease inside the cell and this ATPase is continuously working, then this channel will work more and more. Its speed will become fast, so the more sodium come inside. When more sodium come inside, then more and more calcium go to the interstitial fluid and go to the blood circulation. So more calcium will absorb by the help of thiazide drugs. So it is very useful drug, and it uh, given the patient when hypocalcemic condition. The next group of drug is a Spironolactone and Triamiterene and Amiloride. First, see here, these three drugs. These are two group of drugs. These two groups of drug act on the principal cell of the DCT or collecting duct. The action mechanism of these two group of drug are different and function is almost same. What's happened? Spironolactone, it's bind with the aldosterone receptor in principal cell. See here, this is aldosterone receptor present on the principal cell. So when these drugs bind with this, so aldosterone uh, come to the adrenal gland, but cannot bind here. When this cannot bind here, then they cannot stimulate this nuclear machinery, so not more increasing in the sodium absorption. And the next group of drug is triamiterene and amiloride. These are the same function, but they cannot bind on the aldosterone receptor. They bind on the sodium channel. So this they drug bind here. So the aldosterone bind on their receptor, and ATPase, sodium potassium ATPase become more. But because of deficiency, no more sodium absorption occur by the principal cell, because the sodium channel will block by these drugs. So these are the action mechanism of these drugs. They are used as their time if we need hypocalciuria. It means uh, so we uh, give the thiazide drugs, so hypocalciuria occur. And we need if you need hypercalciuria, then we give the drugs group of furosemide, and hypercalciuria occur. So this group of drug is very useful when it's need.